No one warns you about this part, not in the pregnancy books, not at the baby shower, and definitely not on the Instagram highlight reel. Research consistently shows that urinary incontinence increases during pregnancy and is one of the most frequent pelvic floor symptoms. Pelvic floor muscle training works. It is one of the most evidence-supported interventions for stress urinary incontinence. We have to talk about addressing constipation because constipation increases pressure on your pelvic floor and can worsen leakage. So pregnancy hormones, including things like relaxin and progesterone, they alter collagen, they alter the tissue elasticity. For so many women, before and after pregnancy, bladder leaks become an unspoken companion. They're common, they're disruptive, and they're wrapped in silence. So today, we're going to break that silence. This podcast is about urinary incontinence in pre- and postnatal women's bodies. But more importantly, it's about bodies that have carried life, the myths we've been taught to just accept, and the powerful truth that leaking is common, but it is not something you have to just live with. We're talking science, real stories, pelvic floors, pressure, hormones, healing, and the freedom that comes when we stop whispering about something that affects millions of women every single day. If you've ever thought, is this normal? If you've ever felt embarrassed, frustrated, or dismissed, this conversation is for you. So let's talk about it. Now, if you're pregnant and you have noticed leaking urine, perhaps when you cough, laugh, sneeze, exercise, or even just stand up a little bit too quickly, I want you to hear this straight away. You are not broken and you are definitely not alone. Today, we're going to talk about what's normal, what's not, why leaking happens in pregnancy, what the evidence says actually helps, and when you should get extra support. And I'm also going to share some light bulb moments that most women are never told, but that can change how you manage this completely. We're going to start by naming it. What is leaking in pregnancy and how common is it? Now, leaking urine in pregnancy is usually called stress urinary incontinence. Basically, that means leakage that happens with pressure. So things like you're coughing, sneezing, lifting, running, jumping, or sometimes even getting up from a chair. It's very common, but we should never confuse things being common and things being normal, because leaking urine in pregnancy is still a sign of dysfunction. We've just been putting up with it as women for far too long. Research consistently shows that urinary incontinence increases during pregnancy and is one of the most frequent pelvic floor symptoms. So it's definitely not rare, it's definitely not unusual, and it's common enough to know that if you're experiencing it, you're in a very big club, but that doesn't mean you should just accept it without support. You can proactively change it. Now, the first myth that we have to bust is that leaking urine is not just a weak pelvic floor. Most women will just hear one message: do your pelvic floor exercises, do your pelvic floor exercises. And yes, pelvic floor training does matter, but leaking in pregnancy is not always because the pelvic floor is weak. Sometimes it's because it's not coordinating well, or even that it's too tense, or you're doing pelvic floor exercises in a way that increases pressure without improving control. Pelvic floor function is about strength, yes, but also timing, relaxation, and how the pelvic floor works together with breathing and the deep abdominal system. So if you have been doing squeezes and it's not changing anything, it doesn't mean you're failing. It might mean that you just need a different approach. Why pregnancy increases the risk of leaking? So we're going to break down some of the key drivers that you need to know about. The first is mechanical pressure. So as your uterus grows, it increases the pressure on your bladder. Your bladder essentially has less space, and so it fills up faster, and that's why you often pee more often during pregnancy as well. Second is changes in the connective tissues. So pregnancy hormones, including things like relaxin and progesterone, they alter collagen, they alter the tissue elasticity. That's essential for pregnancy and birth, but it can also reduce the firmness of the support around your bladder and urethra. Third is changes in the workload of your pelvic floor. Your pelvic floor is literally supporting more weight for longer. And so fatigue can play a role as your pregnancy kind of progresses. Fourth, posture and rib cage changes. So as your pregnancy progresses, your rib cage flares and your center of gravity naturally shifts. That affects how pressure is managed through your trunk and can change how much downward pressure is then placed on your pelvic floor, even just with your kind of normal everyday movements. And the fifth really important piece that women never hear is pressure management. So important. So we're going to unpick it more. A big wow moment often when I speak to women navigating leaking is a pressure management problem. Many leaks are triggered by an increase in intra-abdominal pressure. So pressure inside your abdomen suddenly rises when you do something like a cough or a sneeze or a lift or a stand. And if your pelvic floor and deep system don't respond quickly enough, or you hold your breath and brace, that pressure goes down onto the bladder and leaking happens. So for many women, the fix is not just more squeezing, it's learning pressure management strategies. And this is where you can get results the quickest, even in pregnancy. What's normal and what's not normal? Let's make this really clear. Some of the most common things we see in pregnancy are leaking with those increase in intra-abdominal pressure movements. We see increased urine frequency and occasional urgency. These things occasionally can be considered more normal in pregnancy, but any leaking does tell us there is an underlying dysfunction. Things that are definitely not normal and should never be ignored are burning or pain when you pass urine, blood in your urine, fevers and feeling unwell, sudden strong urgency of urination with pain, leaking that starts with a new back or pelvic pain, difficulty emptying your bladder, or a constant leak that feels like you can't control or stop it. It's also an important note that if you think you might be leaking fluid continuously and you're unsure if it's urine or your waters, always contact your maternity team. It's better to check. I see this all the time and honestly can be quite hard to figure out which it is in those final stages. Now, let's talk about the evidence, the what can we do bit, the evidence-backed foundation. Pelvic floor muscle training works. It is one of the most evidence-supported interventions for stress urinary incontinence, especially in pregnancy and postpartum. We know that regular, correctly performed training can reduce the likelihood and severity of leaking. But the key words are regular and correctly performed. Most women are never assessed. They're told to do squeezes without knowing if they're even doing them correctly. They don't know if they're over tensing, whether they're bearing down instead of lifting up. So if your leaking is persistent, a pelvic health assessment is one of the most valuable things you can do for your body. We need a practical plan that's actually going to help you. And I'm going to give you a structured plan that you can start today. Step 1, stop pushing through bladder signals. If you're holding urine for really long periods, your bladder can become irritable and urgency to urinate can actually increase. So aim to pee around every 2 to 4 hours, but also avoid the just in case wheeze, the ones where you pop every 20 minutes, because that can actually train your bladder to hold less. Step 2, master the knack. This is your friend in pregnancy. This is another one of those game-changing strategies that's also backed by evidence. The knack is a cleverly timed pelvic floor contraction just before doing that cough, sneeze, or laugh that can cause leakage. It helps to close the urethra and reduce that leakage. It's not a long squeeze, it's a quick response, a bit like blinking. We can practice it daily and then apply it during those triggers. So just before that cough or that sneeze, think about doing a full relaxation of your pelvic floor, let everything go, and then a quick exhale and engagement, that quick, fast switch on that can really help to close that urethra and prevent that leakage. Step 3 is to change how you move. Instead of holding your breath when you lift or stand, exhale with the effort, E for E, or blow before you go. Exhaling reduces downward pressure, and we really want to reduce any more pressure on our pelvic floor during pregnancy. Breath holding actually increases it. So for example, when you're standing up, breathe out as you get up. When you're lifting, breathe out as you lift. And when you feel a cough coming, do the knack as you exhale. Step 4, the right pelvic floor training basics. Now, a helpful baseline, generally speaking, is some slow endurance holds. So holding that pelvic floor contraction for about 6 to 10 seconds, and then repeating a few times with a good rest in between so you're not over fatiguing your pelvic floor. And then doing some quick, fast squeezes. But this always should be tailored. Pain, heaviness, worsening symptoms can actually indicate overtension or an incorrect technique. Remember, we need to make sure every muscle in our body is strong but functional. So having a muscle that's in a complete state of tension is unhelpful. If you were training your bicep, you would squeeze the muscle and relax the muscle. Make sure you do that relaxation with your pelvic floor as well in between that contraction. Step 5, constipation. We have to talk about addressing constipation because constipation increases pressure on your pelvic floor and can worsen leakage. Pregnancy constipation is really common. Hydration, fiber, movement can be really important. And for some women, they might require medication to support that. But absolutely avoiding constipation, and when you are opening your bowels, popping your feet on a little step or stool and leaning your elbows onto your knees to really help the colon be in an optimal position, help excess strain on your pelvic floor. I always say addressing constipation is one of our most powerful tools to reduce the chance of pelvic organ prolapse. So it's definitely something to get on top of. Step 6 is reducing bladder irritants. So things like caffeine, fizzy drinks, and even some acidic foods can irritate your bladder and increase urine urgency. This isn't about cutting everything out. That would be miserable. But if your urgency symptoms are high, then just trialing doing that for a week or 2 can sometimes really open your eyes to what might be going on for your body. And lastly, step 7, supportive products without shame. So if you need things like pads or liners, use them. If you need to change your exercise style, do that. The goal here isn't to pretend it's not happening. It's to support your body while you improve your symptoms. So pads absolutely have a place, but they're not your long-term solution. But they can really help boost your confidence or allow you to do the things that are important to you whilst you navigate getting that support and getting on top of that dysfunction. An important question is around, should we exercise in pregnancy if we are experiencing leaking? And if you leak during certain movements, high impact workouts, jumping and running, this is your sign that actually you can't manage that excess pressure at the moment. It's your sign to modify. It doesn't mean not exercising, but actually just choosing forms that reduce some of that impact and reduce some of that pressure is important. And again, this is where having that hands-on pelvic health specialist is really important to assess, well, what's going on for your body, and then help you to return to those higher impact movements safely. And honestly, early support really matters here. Pelvic floor care, understanding, and rehab are crucial. We know that earlier we address pelvic health complications, the easier it is to improve it. So let's bring this all together. We know leaking urine in pregnancy is common, but it's not normal and it's not something you should suffer through silently. It's often a combination of pressure management, hormones, tissue changes, posture, and pelvic floor timing. The biggest shift is that it's not just about squeezing more, it's about coordination, it's about timing, and crucially, pressure management.